Hair loss and hair thinning are tricky symptoms that often come along with Hashimoto's. And the reason for that is because the cause is typically multifactorial in nature. And although there's a long list of potential culprits, in today's video we're going to talk about the 3 most common reasons that we see in clinical practice for having issues with your hair, and we'll also give you some context and information that you can consider to help and potentially support these different areas. And as always, if you're enjoying this kind of information and you like these kind of videos, don't forget to subscribe to the channel and also ring the bell. That way you'll be notified when I post a video every single Thursday. My name is Dr. Bodle, and I specialize in helping women with Hashimoto's and low thyroid to lose weight and improve their energy naturally. But one of the other common symptoms that many people with thyroid issues deal with is hair loss. So let's start out today by jumping into our first potential cause, which is autoimmune inflammation associated with our thyroid gland. If you've watched my content before, you'll know that there's a difference between having a problem with the quantity of thyroid hormone in the body and the utilization of that hormone in the body. When it comes to Hashimoto's, we oftentimes have an issue with the utilization, and the reason for that is due to the inflammation that is associated with the autoimmune process. That means that even if you're taking your medication and your labs all look good, you can still have symptoms because the inflammation that comes from the immune system can interrupt or block that hormone from binding and activating our cells. If we have blocking of that last step, then we're going to have a decrease in metabolism, and that can strongly impact areas like our hair growth. To improve this part of our physiology, it's not usually about taking more medication, nor is it about taking things like iodine or tryptophan to try to boost our thyroid activity. Instead, what we want to do is we want to focus in on the immune system, because that's the part of our body that isn't working right and leading to the changes in the way that our thyroid gland is working. The best way to do this is by reducing potential inflammatory triggers, which most commonly include things like diet, infections, emotional stress, and environmental toxins. Then from there, we can do things to help support the way our immune system works by looking at anti-inflammatory compounds and potential deficiencies in micronutrients. As many of you already know, I think a great way to start managing some of that inflammation is by focusing in on our diet. And the reason for that is because it may be one of the only things that we have under our direct control. Now, I typically recommend that people start with a low immunogenic or paleo-style diet, which essentially means that we're avoiding the more common food allergens, things like grains and dairy, and selecting a minimally processed whole foods approach. Now, if we need to take it one step further, we can do that, and we can progress into areas like autoimmune paleo and other specialty diets as needed. In regards to supplements, I like to use things like glutathione, curcumin, omega-3 fatty acids, and vitamin D. But if you've used other compounds like alpha lipoic acid or CoQ10 or resveratrol, and they seem to work well for you as well, then that's totally fine. We always want to make sure that we have a thought process behind the selection we're making, and it's also fitting well with our body. The other point that is important to take home is that these supplements are not focusing on that whole replacement model. So whether it is medication or natural strategies for thyroid hormone replacement, these don't really have anything to do with that. Instead, it's about managing the inflammation and optimizing the pathways, and once we do that, we can have better outcomes with our symptoms. Reason number 2 for struggling with hair loss is due to low iron. Now, this is another topic that we've covered before, and it's really something that you need to talk with your doctor about, because whenever it comes to iron and iron supplementation, we have to be careful, and we want to make sure that we avoid things like iron overload. That said, people with low thyroid issues often have problems with low iron and really low micronutrients in general. The reason for that is because our gastrointestinal tract heavily relies on good input from our thyroid, and if we don't have that, then we tend to decrease the amount of micronutrients that we can absorb from our food. To make matters worse, thyroid changes can also lead to hormonal imbalances, and for a lot of women, that can show up as symptoms associated with their menstrual cycle. Now, men can have low iron too, but because blood loss is so heavily associated with a loss of iron, when we talk about women's menstrual cycle, it's an easy way that they can become more deficient in this particular area of need. To assess iron status in the body, we want to look at a full iron panel on our blood labs, which includes markers like total iron binding capacity, serum iron saturation, and ferritin. By looking at these numbers in context with one another, then we can really determine whether or not this is a particular area that we need to look at supporting. Ferritin tends to be one of the more reliable markers when it comes to assessing iron status, but there's a couple pitfalls that we have to be aware of when we're making our assessment. The first one is that ranges will vary. So if you look at your labs, you'll see that the bottom end of the ferritin range is 15 micrograms per liter. But that seems to be the bare minimum for what we need. The World Health Organization suggests that women who are still of menstruation age should be above 30 micrograms per liter, but recent research has said that we should be above 50 micrograms per liter. To add one more complex layer to that, there's been additional research that says that more complex metabolic processes like hair growth require even higher levels of iron status, potentially up in the 80, 90, or 100 micrograms per liter range. So I'm not saying that you necessarily have to be on the higher end of things. I just want you to consider the fact that just because you are within range doesn't mean that your body is necessarily optimized to be able to do things like have productive hair growth. The other problem with ferritin is that it can be influenced by inflammation. And this is a little bit of a tricky subject, but I've actually made a full video on it. And if you're interested, you can check it out and I'll just link it for you guys right up above here. But essentially, ferritin is what we call an acute phase reactant, meaning when there's inflammation in the body, ferritin will increase on our blood labs, and this might obscure a potential iron need. So much so that people with diabetes, it has been recommended that we don't use ferritin as a marker for iron because of the inflammation that is associated with the diabetic process. Now, of course, that doesn't necessarily apply to thyroid, and not everyone with thyroid issues has diabetes. But I think it is an important lesson that we can take from that situation and say, well, in the case of Hashimoto's, we know that inflammation is also present, and therefore it may skew our understanding of what we're seeing on our blood labs when it comes to iron status and ferritin. This is why it's so important that we do things like manage inflammation first, whether it's through diet, lifestyle, supplements, etc. And then when we do a follow-up lab test, we can really determine what our actual ferritin levels are. Because if all of our inflammatory markers are being reduced and we're seeing improvements in those areas, then we can look at our ferritin value and say, hey, this is a more real representation of where we're actually at. If you and your doctor do determine that iron support may be necessary for you and your hair growth, then there's a couple ways that we can go about this. We can either look at being more intentional with our food selection, or we can do direct supplementation. Of course, in severe situations, iron infusions are also a possibility. When it comes to food recommendations, I steer people towards heme-based iron, which tends to be more absorbable. You can get these in organ meats like liver and spleen, and most people don't like to cook or eat these options, and so I often recommend getting them in a capsule form. But if you want to go the route of simply direct iron supplementation, I recommend choosing a product that has ferrous bisglycinate instead of something like ferrous sulfate, as it tends to have less issues with digestive cramping and constipation. But I would love it if you could leave me a comment and let me know if hair loss has been something that you've struggled with in regards to your Hashimoto's. Also, feel free to share if there's any strategies or things you've done that have helped you to improve your hair loss. I'm looking forward to hearing you guys' feedback, and also hopefully your ideas might be able to help out someone who's struggling with the same problems. Our last cause of Hashimoto's hair loss is insulin resistance. Now, when we have low thyroid function, it increases the likelihood of developing things like insulin resistance, which essentially means that we don't do as good a job of shuttling glucose from our bloodstream into our cells. And the reason for that is because insulin, which is a hormone that helps to facilitate that, doesn't bind as well to the cells because of generalized increases in inflammation. If insulin isn't binding well, our body will tend to crank out more of it to try to facilitate its action and function. And you can kind of think of this like if you were packing for a long trip and you couldn't get that suitcase closed just by pushing down on it, you might hop on top to try to give it a little bit more oomph and actually get that suitcase closed. You can think about it kind of in the same way to this. So if our body is increasing the production of insulin, we can of course check that on the blood labs, but the other way that we can really associate changes in insulin is by looking at our symptoms. So if you notice differences in energy when you go without eating or when you do eat, then that's a clear sign that there's some sort of dysfunction with our blood sugar regulation and with the insulin response. Some things that I tend to look for with patients is if they go too long without eating, they tend to become symptomatic, or when they do eat, they feel very fatigued, sleepy, and tired afterwards, and they continue to have cravings for sugar. All of these show that we aren't really regulating this process appropriately because we should really have normal energy levels throughout the day. When we eat, that should resolve our hunger, not necessarily resolve or change our energy. But when we see these fluctuations in energy and we can then make the assumption that insulin is not working appropriately, we need to keep in mind that insulin doesn't just regulate our blood sugar. It's also involved in other processes in the body, one of which is hormonal balance. So in women, what can happen when we have these chronically elevated insulin levels is that they will tend to convert estrogen into testosterone. Now, this is a problem because if we have increased levels of testosterone relative to our estrogen, it can start to create hair thinning because in women, estrogen is really important for maintaining the health of our hair follicles. What this leads to is hair thinning or hair loss mostly on the crown of the head, and it will progress consistently over time. The way that we address this is by going after the blood sugar and insulin problems. And to do that, we want to reduce the amount of processed and refined carbohydrates that we're taking in, while we also increase the amount of protein and healthy fats that we're consuming. If we do that, that can help to stabilize our blood sugar, reduce the overall amount of insulin that's being released, and a good sign that you're making gains is by noticing that you won't have those energy changes around your meal times. Now, I know I said at the start of the video that I only wanted to cover 3 of the most common reasons for Hashimoto's hair loss, but I want to throw one more thing at you guys that I think is important for you to consider, and that's potential reactivity to medication. Now, in the case of Hashimoto's or any autoimmune condition, there's the possibility of reacting to things in our environment, whether that's medication, food, or supplementation. And if there are particular binders or fillers in a medication that you're taking, even if it's with the intention of helping you out with your thyroid function, it can still lead to inflammation and it can still lead to symptoms like hair loss. So even if you're taking an equivalent amount of thyroid hormone from one medication to another, there could be differences in the way you respond to it, and that could have a direct implication on your hair. So for a lot of my patients who have kind of determined that this is a problem for them, they may have gone on a vacation or maybe they weren't as consistent with their medication as they should have been. And when they go off of it, sure, they might feel more tired or they might have other thyroid-related symptoms, but they tend to see that their hair loss improves. They tend to see less of it coming out in the shower and less of it when they brush their hair. So if this is something that tends to come up for you, it may be something that you want to discuss with your doctor and potentially look at alternative options for medication. But to quickly recap, the most important point of today's video is that we might have to do multiple things to support our hair growth. And that can include managing inflammation that's associated with autoimmunity, looking at micronutrient status, specifically iron, and also stabilizing our blood sugar and insulin so that our hormones can come back into a more normal balance. If you're interested in any of the topics that I covered today, I've made videos on each one of them, and you can check those out on my channel, but I'll also make sure to link them below. If you're interested in working with me one-on-one, then you can send me an email at contact@seattlethyroidhelp.com, and I will get you the information that you need to be able to sign up for a free consultation where we take some time to listen to you, figure out your health history, and determine if we can be a good fit to work together. Also, make sure to download my free guide, which is 109 foods to boost your thyroid and improve your energy, which includes a comprehensive list of foods on an autoimmune paleo diet that will help you to start making some changes, reducing inflammation, and supporting your overall thyroid health. But that's all for today. I hope you guys enjoyed it. This year continues to be a bit of a crazy year to say the least, so I've been thinking about you all a lot. I hope you're doing well and hanging in there. Otherwise, feel free to reach out to me if you have any questions. I'm happy to help you out and answer those to the best of my ability. But my name is Dr. Brad Bodle. Thanks again for hanging out with me, and I will see you guys next week.